So I will pass it over now to our final group.
Hi,
Oops.
everyone. Hi. No, that's okay. You can move on to the next slide too. My name is Viddy. I'm one of the NYSCHECK scholars for Long Island, and I've also been mentoring the Long Island Long Island and New York City group of students who are, some of them are pictured here. So just a refresher, I know you guys heard a little bit about what NYSCHECK is in the beginning and what NYSCHECK Summer Academy is, but we are a group of high school, college, and med school and beyond students who are interested in addressing climate change and impacts on children's health. And I will pass it along to Liza to start our presentation.
Hi, I'm Eliza. I'm a second year medical student at New York Medical College, and I live in the Bronx. So we're going to be talking a lot about the South Bronx today in our presentation. An average of 350 New Yorkers die from the heat in New York City each summer, which is really any one person dying from heat is too many. So 350 is a lot. And the South Bronx neighborhoods are on average 8 degrees hotter than other neighborhoods in the city that are less than a mile away. So just looking at kind of the basic heat map there, you can see that there are different parts of the city that are disproportionately affected by heat. Next slide. Thank you. So in New York City, we consider extreme heat temperatures above 95 degrees Fahrenheit, but just in general, levels of heat have been increasing over time. We know that greenhouse gas emissions are causing the planet to heat up. We're experiencing climate change every day, every year. And as the planet has become warmer and continues to become warmer, the frequency, intensity, and duration of heat waves are increasing across the country. Next slide, please. So in New York State, the average and maximum temperatures are continuing to rise, and our state is warming quicker than the national average. New York City itself is the warmest part of the state. There, in general, is a greater heat impact in urban areas due to the abundance of roads, parking lots, and buildings, as well as the lack of green spaces. So this map is showing, again, the heat vulnerability indices across the country. You can see it's not uniform, not across the country, across the city. You can see that it is not uniform across New York City. And I put that little turquoise, if you can see it, it's a little small, to kind of point you in the direction of the South Bronx, which is what we're focused on today with our group. But there are a variety of different areas that have particularly high heat vulnerability indices. Many of the areas with the highest level of heat vulnerability are home to Black and Hispanic communities. You can see on the chart on the bottom there, the average annual rate per million people of heat-related deaths between 2013 and 2022. And you can see that Black and Hispanic communities are experiencing the highest rates of heat-related deaths. In general, under-resourced communities are at a high risk for extreme weather-related deaths, and the federal redlining in the 1930s resulted in many Black and Hispanic communities across the city being exposed to more extreme heat due to their dense populations and lack of heat-reducing features like green spaces, shade, and water. Next slide, please.
Hi, I'm Ava Rubenstein, and I am a resident of New York City, and I'm a high school student. I'm a rising senior. So we just compiled some of the recent headlines across New York City, and they're all discussing different experiences with extreme heat. So the first one, Scorched by History, discusses the extreme heat effects specifically on vulnerable populations. And the caption mentions that Black residents die from heat stress at double the rate of white residents in NYC, which is obviously a big issue. And additionally, it mentions that statistic that we previously mentioned, where temperatures in the South Bronx are 8 degrees higher than on the Upper East and West sides, which is a pretty alarming statistic. And then the article called Dog Days of Summer discusses the impact of extreme heat upon New York City residents and highlights some methods of staying cool, and it discusses many city initiatives that attempt to combat the effects of extreme heat, which is definitely worth looking into, such as cooling stations throughout the city and other initiatives that help New York City residents stay cool in extreme heat and extreme weather. And furthermore, the final article on the screen, the article about New York City area schools is a list of over 20 schools that have been forced to close early simply due to the effects of extreme heat, which is extremely alarming. And next slide, please. Thank you. So these are some experiences with extreme heat in NYC. I saw that this experience was highlighted in the chat as well, but we wanted to highlight the exposure of playing on turf fields, because turf fields are dangerous for kind of one or two reasons. First of all, they trap heat, and when children play on turf fields in hot weather, they're exposed to more heat than they would be just kind of walking around or playing on grass fields, because the chemicals in the turf trap the heat, which causes a higher risk of dehydration and heat-related illness, which is a danger for children. And furthermore, many turf fields also have chemicals in them that can cause children to be exposed to chemicals. So not only do they pose risks for extreme heat-related illnesses, but they also can elevate chemicals in the bloodstream. And furthermore, in just one day, there were more than 25 ER visits across New York City related to only extreme heat. And these numbers are only continuing to rise as extreme heat becomes more prevalent throughout New York City and throughout the country. And furthermore, though 90% of households across the 5 boroughs have air conditioning units, that number greatly varies across neighborhoods. And since we're focusing on the South Bronx, it's important to highlight that only 76% of the residents in the South Bronx have air conditioning, and air conditioning is an extremely helpful resource for those trying to combat extreme heat, and not having air conditioning exposes them to extreme heat more so than it would be if they were able to access this resource. Next slide, thank you.
Hi, I'm Tiffany, and I'm a rising sophomore in high school on Long Island. So what communities are at most risk of extreme heat? Older residents with health conditions experiencing social isolation or limited mobility, along with individuals with mental illnesses, undomiciled individuals, and people who work in hot outdoor places like construction workers are all vulnerable and more likely to be impacted by the heat. Next slide, please. Additionally, infants and children up to 4 years old and pregnant people are more sensitive to heat. Also seen in pregnant people, the increase of their body temperature can cause premature labor and lower birth weights. Next slide.
Hi, everyone. My name is Sanari Hanayaka, and I'm a second-year medical student at New York Medical College. What we're looking at on this slide is a tree equity score for Mott Haven, which is a neighborhood in the South Bronx. And you can see the score for this area is 62, and scores less than 70 from this equity score indicate that there's a major need for more equitable tree coverage in this specific area. And we can also see on the right-hand side, it comes with a priority index, and it shows that specifically in this area, people of color, the 92%, as well as people in poverty, 85%, have an increased need for tree coverage in this area, which demonstrates that marginalized communities are being disproportionately affected by the lack of tree coverage. Next slide. And these next couple slides are from New York City's Heat Vulnerability Index, and we're looking at Mott Haven again as an equal comparison. So this slide shows that in Mott Haven, there's less AC and green space than other New York City neighborhoods. Next slide. And it also shows that they're lower median income than other New York City neighborhoods, but despite these, they have a higher temperature. So it shows that in Mott Haven, these other factors contribute to an increased temperature, and the lower median income could contribute to why they don't have accessible AC to combat these increased temperatures. Next slide.
So this is a bar graph of the heat stress death rate in New York City. And as you can see, the Black non-Hispanic race are greatly impacted by the extreme heat. And as said before, this mostly stems from structural racism. That includes fewer job opportunities and lower pay and less access to high quality education and healthcare. This system tends to limit the access of the resources to protect health, as Black New Yorkers are more prone to poverty and have less access to air conditioning. Next slide.
Hi, my name's Naya Jackson. I am a second year medical student at the Jacobs School of Medicine and Biomedical Sciences. So we wanted to just highlight also some of the policies or different things that are going on in the city to help mitigate the extreme heat. So the New York City Emergency Management is an organization that's working to help New York City residents beat the heat. So some of the resources include maps of cooling centers around the city, cool kits, information about the risk, and then safety tips. The next slide will go more into that. But it's also important that they educate the public on ways that they can beat the heat of things that they can also control. So they can like beat the heat by staying out of the sun and staying like cool places, avoiding hard labor during the sun peak hours, which is usually around 11 a.m. to 4 p.m. So they try to recommend for people to kind of like, if you have to do strenuous things, to do anywhere from 4 to 7, but obviously that can be hard depending on your occupation. So if you are working in places that forces you to kind of be outdoors, to make sure that you're resting, staying in the shade, and then also staying hydrated by having water breaks every 15 minutes, eating small, frequent meals, seeking out air-conditioned places like movie theaters, and then also wearing lightweight clothing can help like residents beat the heat as well. Next slide.
Hi, I'm Ramesa Agmani, and I'm from Yonkers, New York, and I'm a rising junior at Connecticut College, and I'll briefly cover some of the current New York City local policies and programs that are put in place to combat the extreme heat. So listed below are several newly implemented policies and programs that I've researched, but for the sake of time, I'll only focus on a few that are like most relevant to our vulnerable population that we're studying. So to start off, the New York City Cool Roofs program, which it's been mentioned before, trains local individuals to work with a team to coat city rooftops with an energy-saving, white reflective coating in hopes of limiting the effects of extreme heat. This program has the goal of installing 1 million square feet of rooftops per year. Next, New York City designed an interactive 24/7 cool options map, and this allows New Yorkers to easily locate cooling centers throughout the city. It highlights water features such as nearby sprinklers, drinking fountains, and outdoor pools for people to easily cool down in. And it also shows nearby New York City parks that are densely populated with trees so you can aid in shade. And finally, emphasizes which communities have the highest heat vulnerability index so people can hopefully try to avoid them. And finally, New York City implemented the Cool Kits for vulnerable populations. And basically, this is a program where New York City Emergency Management plans to distribute cool kits and they contain heat safety items such as cooling towels, ice packs, electrolyte powder, and sunscreen. And they're mostly focused towards delivery drivers, outdoor workers, and other at-risk groups. And these are people that have no option but to work in the extreme heat. So overall, these plans hope to increase awareness about the dangers associated with extreme heat, and they hope to educate the public about heat safety information, especially when it comes to vulnerable populations, so they can all beat the heat. Thank you.
So now we're going to cover adaptation and mitigation strategies. So we wanted to talk about some policy change. So although there is a program, I can't remember the exact name, that helps increase air conditioners that are like distributed across the city, we believe that there should be a New York City policy to mandate landlords to provide air conditioning during the summer, because although some of our residents can go to these cool spaces, it's important that they are also staying cool in their own homes. And then some of the co-benefits is improving tenants' comfort and quality of life, and allows community to adapt to the heat waves and changing temperatures, not only, of course, in the public, but also in their own homes. Some of the consequences is that it increases the energy consumption for the AC, and then also the cost burden that may be applied to the landlords and may trickle down to the residents. Next slide.
Okay, another adaptation mitigation strategy for extreme heat is implementing green infrastructure. Green infrastructure reduces temperature by providing shade. Green infrastructure is where you use nature to help cities manage rainwater, cool down, and clean air. So examples of green infrastructure is green roofs, green walls, parks and green spaces, and cooling centers. A study shows that green roofs cools near surface temperatures by 14% compared to solar panels. green infrastructure reduces temperature by providing shade. It also provides several health benefits. And as with, such as decreasing pollution and respiratory alignments, coughing, and aggravation of asthma. Also, there are potential consequences. Green infrastructure could be expensive. It does need a constant maintenance, and it may be destroyed during extreme weather like storm. Over here is like an example image of green infrastructure implemented in Singapore. As you can see, they blend green infrastructure beautifully with like buildings. All right, next slide.
My name is Gloria Zhao. I'm a second-year medical student at New York Medical College. So there are solutions that we can propose that combat extreme heat. As we discussed before, one of these solutions includes substituting turf fields with grass fields. This is especially important for children as they're out of school for the summer. They're participating in summer camps and sports, so they're spending more time outside and on fields. And some of the concern for this is that grass fields do require more maintenance, but this also presents an opportunity for new jobs. Another solution is making sure that the heat benefit is funded throughout the entirety of the summer. As we've experienced with climate change, the summer season it seems like it's becoming longer and longer. So it's really important that residents have the help that they need for the entirety of the summer. For urban areas, it's also important to create more green spaces because it has been shown that they can lower temperatures. So it's important to inform the public about all this. So not many people may know about the public resources that are available to them and what policies are in place. So we want to spread the information via public campaigns and community outreach so people can be informed on what is accessible to them. It's also important for people to recognize the signs of heat illness and exhaustion so that they can get help quickly and improve health outcomes. Next slide. So it's important in order to get these things done to identify legislators who are working to combat extreme heat like we're doing now. So we want to inform them about how important this topic is, how it affects our communities, and the health effects of extreme heat. And then we can also propose these policies and solutions that we've discussed to work against extreme heat. We can also work with and support organizations. By working with other passionate people, we can propose solutions to act against this. And we can also listen to community members and find out how extreme heat affects them directly. And we can advocate for the proposed solutions based on their own lived experience. Next slide.
So just to wrap up, by working together with legislators, public health professionals, and individuals motivated to addressing extreme heat, we can make an impactful change in the health of vulnerable populations, such as children living in areas that are disproportionately affected by extreme heat. Thank you.
Well, that was amazing. And it concludes our programming for today. We do have 2 minutes left. Incredible job staying on time. That is really hard to do. We have like 2 minutes left for any questions or comments. I did this QR code here will take you to our NYSCHECK page where you can learn more about all of the resources and programs available through NYSCHECK, including the summer program, which will run again next summer. So please be thinking ahead if you know of any students who might be interested. And I also had a link in the chat to our prescriptions for prevention. The previous group mentioned, work towards educating the public about steps that you can take to protect yourself. And that's something that our prescriptions for prevention program does for extreme heat and other topics. So please, feel free. We're getting a lot of inspired and positive messaging in the chat right now, but feel free to raise your hand or put any final comments into the chat. Really, really excellent work. Thank you all so much. But we can stay on for another moment if anyone wants to share any questions or comments.
And I just want to add a thank you to you, Dr. Sarah Evans. This is a collaborative effort, but you've really led us in an incredible way. Your dedication to the program, to the students, to it all is so admirable. So just thank you to all the faculty, but to you, Dr. Sarah Evans, for really doing a tremendous job with the program. Thank you.
Thank you. And incredible job to all the students and our scholar facilitators. It was really, really excellent. We can certainly share these slides and the video recording after the program as well. And for our students, our doors are always open, and we, encourage you to stay connected with us. And, we can offer other opportunities for advocacy and education with our program. So thank you so much.